Good morning, Elevation Health family and friends. This is Dr. Dave Yachter, the chiropractor, coming to you from our recording studio this morning. And we're going to talk about very briefly heart health myths. It's very often that I have these conversations with many of you, probably at least half of you, where we run into these myths, these false beliefs, and there's a lot of fear behind them and not a whole lot of logic. So I just want to separate these and bring them to you for your understanding and for your benefit. The reason why all this is important is because heart disease is the leading disease killer in the United States every year. Really, I mean, it's the number one cause of disease causing death than any other disease, more than cancer, more than diabetes. Every 33 seconds, a life is lost to cardiovascular disease. So for most of you, probably at least half of you watching this, you're on medication. And the question is, are the medications correcting the cause of your problems? And if not, this really needs to be on your radar. And of course, you and I both know the answer to that question. All too often, I've seen the treatments for these diseases, for cholesterol, for high blood pressure, for diabetes. The side effects are far worse than the disease itself, whether it's in the short term or the long term. So let's dive into a couple of these myth busters. Number one, that your cholesterol should be under 200. It really is amazing because it works out perfect for the pharmaceutical industry when they have created this range so narrow for everybody to fit in and under. And it's so rare that we see people with cholesterol, their total cholesterol under 200 naturally. Because your body needs cholesterol. All cells are made of cholesterol. So for most people, the normal cholesterol level will be over 200. But if everybody can get under 200, and there's a way to do that, hey, we've got the solution. And it's called cholesterol lowering medications, better known as a statin drug. So who has established this range, these normal versus abnormal values? Well, who funded the studies? No less than the pharmaceutical industry. And this is what we have now as a medical standard. It doesn't necessarily mean that it's a healthy range. They have just deemed that the range that is either normal or abnormal. Now, that being said, it's important to understand the function of your cholesterol. Remember, cholesterol is in every cell membrane, in your brain, in your body, and the function of LDL cholesterol, particularly, which has been known as the bad cholesterol, is really necessary to transport this cholesterol to your brain, where your brain uses that to help to fire the neurons. And it performs critically important functions, not just for your brain, but also your immune system. And so when it comes to looking at your total cholesterol level, it's not really just your total cholesterol or where your LDL is or where your HDL is individually that determines normal or abnormal. The most important thing that you can look at is your cholesterol ratio. What is that? If you don't know what that is, we're going to cover that in deep detail in the workshop coming up on March 11th. But I'll tell you right now that your cholesterol ratio is your total cholesterol divided by your HDL. And so when you look at that number, it can tell you if you are closer to abnormal and you really need to take action and what action you need to take, or is it normal? Even though your your LDL may be 150 and the doctor could have concern for you, or your total cholesterol could be close to 300. It doesn't necessarily mean it's abnormal in and of those numbers themselves. You must look at the overall cholesterol ratio. And from there, we can look at what we can do better and improve. And I can assure you, it's not something that a statin medication will help you with, because this is our second myth buster: statin medications prevent heart disease. False. Cholesterol lowering medications do not prevent heart disease. Over the last 30 years, there have been 44 randomized control studies that have been published, and not one of them show that people live longer with lower LDL or lower total cholesterol. In fact, just as many people have heart attacks with low total cholesterol as with high total cholesterol. But other studies actually show that the people with the highest LDL, the so-called bad cholesterol, actually live longer. Because again, that higher cholesterol protects you from cancer. It's a benefit for your immune system, and it helps prevent dementia and Alzheimer's. You need to start to wrap your mind around this, because I know that the conversations that I have with you, many of you, again, are still, you want to be good patients, and you don't want to tick off your doctor. And what that tells me is that you might be making decisions out of fear instead of logic. And I'm not saying not out of faith, because I am a person of faith. But again, what we're talking about here is logic, and it's information, and it's intelligence. So you have to understand that God doesn't make junk. If you were created with this cholesterol in your body, don't you think your body knows what's best for itself? And so we have to start with that principle, with that philosophy, if you will, and understand that when you look at all the research and the data and the science behind it, there's nothing to support that lowering your cholesterol will create health for you and prevent sickness and disease. I can assure you of that. And again, we'll go into this in more detail at the workshop on March 11th. And the third myth buster is that if you have high cholesterol, that you need to have a diet in low cholesterol. You have to take all the cholesterol out of your diet, eat foods low in cholesterol. I was having a conversation with somebody in Sunday school a couple of weeks ago, and she was saying to me, you'd be so proud of me. My doctor has me on this low cholesterol diet. I've taken all the cholesterol out, and I'm thinking to myself, well, this is good when a person's motivated with their health, but when they have the wrong strategy, wow, how can we help an individual with that? Well, again, all we have to do is look at the science, and look at studies, and look at the research, and look at the history. President Dwight Eisenhower had his first heart attack, and as soon as he became president years ago, the cardiologist came in and put him on a low cholesterol diet. And wouldn't you know it, literally a few weeks later, he had another heart attack. And it didn't solve the problem. And in fact, lowering the dietary cholesterol actually will cause your body to make your cholesterol even higher. So here's a study from the American Journal of Clinical Nutrition, 340,000 people that were followed from 5 to 23 years. And the conclusion of the study, it was published, showing that intake of saturated fat was not associated with an increased risk of coronary heart disease, stroke, or cardiovascular disease. In fact, the actual risk for heart disease was 19% lower in the group that consumed the highest amount of saturated fat, which also correlated to more cholesterol in their dietary foods. And so the real question is, how can you ask yourself and your medical doctor intelligent questions? How can you make better decisions? Well, I'll give you the answer right now. Exactly what we're doing here, do more of by furthering your education on the subject. And, it's up to you. It's your decision. It's your life. It's your health. But it burdens me. And, when I see that the wrong information is given out, and people are making less than ideal decisions based on wrong information. And I will never tell you to not go to your medical doctor or get the testing or stop being supervised or under care by your medical doctor. But what I am saying is that you are responsible for your health, not your medical doctor. So the decisions that you and I make, we're responsible for. And those decisions will get you results, either for better or for worse. And if you are not happy with the results that you're getting, then you have to make better decisions, right? All right. And so the other question that you can ask yourself is, if the medication was working, then why do I have to continue to take this for the rest of my life? And if I do have to continue to take these medications ongoingly, what are the risks long term? And if you don't know the answer to that, I would strongly encourage you to make sure that you are at this workshop on March 11th. the Heart Health Masterclass coming up Tuesday, March 11th at 5:45. You're going to learn all about this and a whole lot more at this upcoming event. So make sure, whatever you do, do not miss this. This quite possibly for most of you watching, this is the most important event you do not want to miss all year. So please make sure that you registered yourself, family members, loved ones, whoever you know that's on medication for this or has had a heart attack or is on medication for cholesterol or high blood pressure or they're overweight. You're welcome to save them a seat as well. So seating is going to be limited. So do this as soon as possible. It's first come, first serve. So hopefully this has been helpful for you. Thank you for joining me today. I love and appreciate you. God bless.